Okay, Mohit, I think we should start because it's a Saturday and everybody has some commitment or the other. So, just to introduce and start the session. So, our insurance program actually started during the COVID times when we had first tied up with Edelweiss and done the first program. But then we got a much more structured and much better offering in the subsequent year from Mohit, who himself is a 2019 batch pass out from IMT Ghaziabad. Mohit works with Zopper, and his primary function is to customize, insurance related or health insurance related programs for the alumni communities across the country. B schools, non-B schools, engineering colleges, and all the other schools and colleges that you can think of. Therefore, we got a much better offering, I think, in the super top up. We are now, based on consumer feedback or feedback from the alumni, we've also come across a very essential need, which is, while insurance covers the main part of your medical expenditure, there is also an expenditure when you go to the doctor, pay his fee for a normal appointment, or when the doctor actually prescribes a test to you. That is OPD expense, which can amount to good amount, like good high amounts of money going out of your pocket. The current offering is therefore for the OPD benefits that we are launching today. And I would request, Mr. Vikram Shah, I don't see on the call, but he is the person who has been, spearheading the insurance program right from day one to now. If Mr. Vikram Shah is there, I don't know, but we'll ask him to speak at the end. But
Vikram sir is there, sir, on the call.
Oh, wonderful, wonderful. So I think he has, been able to streamline the program for the benefit of the larger alumni community. And I would request Mohit to now take us through and tell us about the program.
Sure, sir. So Vikram sir, would you like to add anything before I start?
No.
Because it was
Please,
your vision.
please carry on.
I think Vikram sir will speak at the end.
Yeah.
Got it, sir. Got it. Great. So first of all, thank you so much, Devashi sir and Vikram sir, to providing me the opportunity to launch this program as well, because I believe this is a program we would not have, pursued as an organization if there was no support or, interest from your end, because we were not looking at OPD as a product in this financial year at least. And it was Vikram Shah's vision that we brought this program into the IMT. And let me also tell you that this is the first time we are launching any program, or so to say, any alumni association is launching a program, OPD insurance program for their alumni. There is no such program available in the market. So we are the first ones to do it in the entire India. So first of all, I'll give you a brief about Zopper, what does Zopper is into. So Zopper is one of the India's largest insurtech firm. So we are now a decade-old organization. In the last 10, 12 years, we have raised somewhere around 100 million US dollars, out of which 75 was raised in 2022 as well. So if you see a market where there is, winter funding and people are not getting funding in the market, we are getting inbound requests. We are currently also in a stage of raising Series D funding with a $50 million inbound request. Again, we as an organization are into innovative products. So the value what we create is we design innovative products, insurance related products in the market. So if you have seen extended warranty product where you go and buy any Chroma product or any Titan Eye product and you get an extended warranty, that product is a Zopper product. So we are a market leader in terms of extended warranty as well. So we are a 700 plus organizations spread across India. We have multiple offices across India. And these are some of the clients what we are serving right now. If you see on the table, we have IIM Kozhikode, IIM Bangalore, IIT Roorkee, IIT Madras, NIT Warangal, SP Jain, Goa Institute of Management, IMT. We are also launching the program in NIT Durgapur, NIT Hamirpur, Sharda University. We are also getting mandate from NIT Nagpur as well and other NITs. So NITs are really picking up our program because they as a community feel that they need something like this. So they are after us for the same. And if you see our success story, already in our programs, 10,000 plus alumni have, enrolled into our programs across the institutes, and more than 30,000 plus alumni we are covering, the lives we are covering over here. Now coming to the agenda, what we have, the OPD product, I'll just share that as well. So first of all, I would like to give a brief about what is OPD. So if you go into the market and you go and buy health insurance, some of the health insurance provide you a OPD product as a bundle product, but you don't get a OPD product as a voluntary product available in the market. So even if you go into the market and say buy OPD, you try and buy a OPD product, you will not get such a OPD product, you will get discounting products. So there are some organizations who are providing a discounting product where you will get lab tests, say 40% discount, lab consultations 40% discount, but there is no such product which provides you exclusive benefits or a value benefit to it. OPD is basically when you go to any doctor for any consultation, say you are not feeling well, you have a fever, and you go to and visit a doctor and they charge you $1,000 or $1,500 for the same. This is something which is not covered in any insurance plan, and still you pay out of pocket. So seeing today's time where it's very normal to spend at least 10 to 15K on lab tests and doctor consultations, this is a huge amount which we are paying towards the health of our family members, of ourselves as well. So the program what we have launched is a program, again is a unique program where an alumni can cover themselves, their spouse, up to 2 children, up to 2 parents or parents-in-law. So they can select one set of parents from the age group to 18 to 70. Children can come into the age group of 0 to 25. So in this program, the alumni has a benefit that they have to just pay 5,000 rupees to get a benefit of 30,000 in terms of lab tests and doctor consultation. So you will have to pay just 5,000 rupees as an amount and you will get 30,000 wallet amount available. That 30,000 you can use it for your doctor consultations as well as for your lab tests as well. Again, this is a cashless program. So you don't have to spend anything from your pocket and wait for anything to get reimbursed. You have to just go and visit the app. You'll have to just select the doctor where you want to visit, and then you have to click the book. You have to book the appointment on the app itself, and you don't have to pay anything on it. You can also include your parents and your parents-in-law into the program. The prices for parents and parents-in-law are 10,500 rupees. They'll get a separate 30,000 benefit into the program. So it's not like that you have to pay 15,500 and you will only get 30,000 benefit. If you pay 15,500, you will get 30,000 benefit, as your primary family will get 30,000 benefit and your parents will get a 30,000 benefit differently. Now, there is also another benefit which we were able to negotiate with the insurer and bring into the program is that there is a 50 lakh of personal accidental cover also included into the program. So for the alumni, there will be a 50 lakh of personal accidental cover. The entire process is end-to-end digitally inbuilt into the IMT alumni portal and app. So you have to just log in into the portal and click on OPD insurance, fill out your details and then pay, and you will get the policy in the next 10 to 15 days. Also, there is no waiting period in this program, no negative list in the program. So even if people, their family member have chronic ailments, they can also come into the program. Also, you can start claiming from day one. So once you get the policy, from day one, you can start claiming in this program. There are certain conditions, there are certain exclusions which are not available in the program. These are generally the maternity expenses, any treatment or consultation related to maternity, any treatment or consultation related to obesity, STDs, HIVs, sex change operations, which are general exclusions in any insurance parlance, they are also included in this program. So the details are given in the brochure as well. So we send out the brochure in all the groups, and you can check the details over there. Yes, so I think that's it from my end. If you have any queries, any doubts, the claim support details are also there. The escalation matrix will also be provided into the program. So that's it. And we are
This
up
is
for
Sadhana. I missed first slide detail. So could you please kind of brief me about first slide detail? I'm really sorry.
first slide is in the benefits part.
Yes.
Okay. So to make it short and simple, the benefits in this program is that if you are going for any doctor consultation or if you are taking any lab test, it will be covered up to 30,000 in 5,000 rupees. So that's the major benefit.
Okay.
Along with it, there is a personal accidental cover for the alumni of 50 lakh rupees.
Mohit, couple of
Perfect. Thank you.
5,000 is the premium, right?
Yes, sir. 5,000 plus taxes is the premium over here.
Taxes would be 9% or 18%, sir?
18%, sir. On the insurance, the taxes are 18%.
Okay, sir.
Mohit, couple of queries. One query
Yes,
is
sir.
regarding the doctors impaneled on the app. So there might be doctors which you want to go and those are not impaneled. What would be the process for that?
Yes.
The query number 2 is regarding the preventive health checkups and certain checkups that you get done on your own basis as a that also be covered under the OPD and tests.
Sure. So I'll answer both the questions, sir. So first question is regarding the network hospitals and the list of doctors. So the insurance product is backed by Aditya Birla. So this is the Aditya Birla product, what we are launching over here. They have 10,000 plus network hospitals and clinics available with 54,000 plus of doctors in their network list. If you have some doctor which is not impelled into their network list, you can impel them as well. So there's an option to add that doctor into the app. So we'll get the details over there.
Does that take? The empanelment, how much time does that take?
So that will depend on the doctor and the insurance team negotiation, because there is generally a negotiation which takes place between the doctor and the insurer. So generally, if the doctor agrees to their terms, maybe in a week or so it will get impaneled.
Okay.
How different it is from Visit? Visit also offers the similar benefits. So is it through Visit or very different?
Yeah. So the product is backed by Aditya Birla, and the app through which you will be getting the benefits is Get Visit app.
Okay, got it.
Yes. Gaurav sir, you had the second question regarding the health checkup. So health checkups are not included into the program, because what we have done is, so if you see, many of the corporates offer OPD benefit as a additional to their insurances. So what we have done is we have only focused on the lab tests and the in-clinic consultations, because they are generally not covered in the OPD program. So being offered by the corporate, they generally require for the tele consultations and checkups and everything are included in the corporate policies.
Mm-hmm. So you mean in case the doctor has recommended certain tests during the OPD, those tests would be covered?
Correct, sir. Correct.
And which are the diagnostic companies, these test providers, which are currently impaneled with the Get Visits app?
So majorly all are covered. So what we could look out at was 5,400 plus diagnostic centers are covered. So if you see the major chains like Max Pathologies or Dr. Lal Paths, they are available in the app.
Okay. Thank you. Thanks a lot.
Okay. Hi, Mohit. Deep.
Yes, sir.
Yeah, Mohit, can you just walk us through, for example, a person wants to visit a doctor. So what will be the steps? For example, using the app, does he have to book an appointment? What all steps he has to do, if you could let us know?
Sure, sir. So what I'll do is I'll just log in from my mobile as well, so that I'll share my screen over there and give you a walkthrough through my mobile. Just allow me a second, sir. So is my screen visible?
No.
Just
No, Mohit, the screen is not visible here. So while we are doing this, Mohit, there are a couple of questions in the chat box. Now it is visible. The screen is visible.
So I'm opening the Get Visit app. Over here, you will log in through your email ID and mobile number, which will be the registered email ID and mobile number. If you go into the benefit section, you see already that there are dummy policy uploaded into my app. I have to just click on the policy benefits. You see 30,000 prescribed diagnostic and in-clinic appointments is available. If I click on offline appointments, it will ask me to book clinic appointment. Say I need a general physician nearby my area, and I know the doctor who I want to visit. I click on it, book appointment. It will ask for the time slots available, whatever the time slots are available for the doctor. Say Monday 7:25 p.m. to 7:40 p.m. is there. I click on next, and automatically once I click on confirm, I'll get the doctor appointment. So I don't need to pay to the doctor when I visit over there. It will automatically be covered from the app. If I say want to build, get the lab consultation done, I have to click on lab diagnostic. I have to upload the prescription, or I might be having my own prescription. Once I upload it, it takes generally 2 hours to verify the prescription. Once the prescription is verified, you can book the lab test.
Okay. Okay. So you will be sharing this, which is this app. Once we take this policy, you'll be sharing us the credentials and then we log in.
Yeah, sir.
Right?
So once you take the policy, and when we will be sending out the policy copies, we'll also give you the instructions on how to log in into the app and a video of the walkthrough of the app, so that it's very easy for the alumni to enroll and get themselves covered over the app.
Okay. Secondly, does it cover dental also?
Yes, so dental consultations are covered, but any
Mhm.
procedure is not covered. So if you go to any doctor for dental consultations, it's covered. But if they doctor do any root canal or any procedure on your teeth, it will not be covered.
Okay.
Only
Okay.
consultations and lab tests are covered.
Okay. Okay.
Okay. I had a question. The question is, usually instead of booking appointment with an individual doctor, we may end up actually at a hospital chain, say Max
Correct.
or Fortis. So, there you're actually booking the appointment of the doctor via Max itself. So, is that available or it's not there?
Yes, sir. So if you see featured hospitals list, so if I say take Manipal Hospital, Ghaziabad, or maybe Sarvodaya Medi Center. So like when you go and visit the hospital, you see there are general, so you always have an idea why you are going to the hospital. You are going for general physician, or you have any particular, say, dermatologist. So you are already aware about it. You have to just click on the hospital and see what are the doctors available. The same way you will do it when you go and visit over there as well.
So is there any way we can get the list of these hospitals which are covered
So once
prior
you
to
go
actually
to the
enrolling? Prior to
yes,
enrolling.
prior to enrolling, sir, again, it's so the reason behind it is that these negotiations keeps on changing. So the insurer and the network hospitals, they always are into negotiation. So there is no hard and fast list available, the hard copy of the list. Same goes with the insurance product as well. So there is generally a link where you can check the network hospitals near the area. In the app, you can go and check the nearby hospitals. It's available.
No, but in the app, we will only get access once we've made the payment.
No, sir, you
So
can
there'll
go
be,
and get the normal access you can get from the app. I can share the name of the app. Normal access you can get, not the sponsored access, but normal access
sure,
still you can get in the app.
sure. That would help.
Yeah, so the app name is Get Visit app.
Get Visit.
Get Visit, sir.
Yes, Mohit, I'm using this app. So app is really simple to scroll through and easy UI. And Mohit, I have a
Wonderful. I think
question. Who all are
Akanksha's
covered in
raised
this
her
insurance, OPD insurance?
Sorry?
Who all will be covered, can be covered in this insurance? Suppose I'm taking this insurance, so my family members, means my spouse, my child, and who else can be covered within one insurance?
Sure, sir. So there are two policy combinations. First policy combination is self, spouse, and two children. So that is first combination. Second
Okay.
combination is parents or parents-in-law. So you can either cover your parents or your parents-in-law. One set of parents is only allowed.
Okay, got it. So these are the two combinations.
Yes, sir. These are the two combinations.
Thank you. Thank you, Mohit.
So I think Akanksha has raised her hand. Akanksha, would you like to put your question now?
Yes, sir. Thank you. So I wanted to check on one thing. Like you mentioned about the dental procedures that is not covered currently, but is there any plans of covering it, the procedures later?
This year, I don't think it would be possible because we already have gone through one set of combinations, one set of benefits for our program. Maybe next year we can look into this, depending on the feedbacks what we are getting and what our coverages people are requesting for us. We can, negotiate with the insurer next year on the same.
Okay, thank you.
Wonderful. So if there are no further queries, I think I would request Mr. Vikram Shah to please speak.
One last query, the two combinations you talked about, is there a premium difference, spouse and two children, and spouse plus children plus one set of
No. So
parents?
yeah, so first policy combination has a price of 5,000. So first policy combination means self, spouse, and two children. That has a price of 5,000 plus taxes. Second policy combination, parents or parents-in-law, has a price of 10,500 plus taxes. Because parents are generally at a higher age group and the risk is very higher. So that's why the price over there is different.
But the policy or the benefit is capped to 30,000 rupees, right?
Yes, benefit is capped to 30,000. So 30,000 for self, spouse, and children, 30,000 for parents. So these are different.
So if I pay 10,000, I get 30 plus 30, right?
Correct. So 10,500 for parents alone, 5,000 for yourself. So it will be 15,500.
Got it. Thank you.
One question, Mohit, regarding the experience of the app. I have found doctors are generally following various systems and they don't have the appointment system many a time. So they might be using Proacto, they might be using this app, and they might be having the offline system also. The system that you showed where the person does the booking and the payment is done and then you reach at that time. Does that actually happen on the ground? Because doctors, I have found these systems are not very strong when it comes to these kind of setups. So how had been your experience on that front?
So when we were negotiating with all the insurers for this program, the reason we went ahead with Aditya Birla is because Aditya Birla is doing very well in terms of the OPD benefits for their insurance products. So the reason we went for the Get Visit as a service provider for this program is because Visit is one of the India's largest OPD program app. So the doctor list what you find over there is more than what they had offered me was 54,000 plus doctors available across India. Also, they were giving us an option to add any doctor we want. So you have to so when I click on add doctor, I have to just click on the name, email ID, mobile number of the doctor, and the team will reach out to them. So I don't have to do anything. The team will add them. And they are always looking out for adding more and more doctors into their network. Their
But
team
my
is always
question
into
is,
it.
no, my question is not towards that. My question is that doctor is empaneled, but when you do the booking, does that appointment timelines are actually adhered at the doctor's front, do they really follow this
Okay.
system?
Mohit, I'll take it.
Yes.
See, what happens is that normally when you go to an hospital and you take an appointment, what happens in this scheme is that you have to go at the counter, at the payment counter, and you have to show your app. And they will deduct from your app, the wallet will show 30,000. So if your doctor fees is, let's say, 1,200 rupees, they'll deduct 1,200 from the app, and your consultation number with the doctor comes in. So suppose you have a 5 o'clock appointment with the doctor, and the doctor is at, you are there in the queue, and the doctor is coming at 6 or 7 or whatever it is. You are in the queue, you have made your payment, and you're in the queue with the doctor, and your consultation will happen.
Okay, okay.
Great. So I think Amar had a question. Amar, would you like to put your question?
Yeah, just wanted to figure out that once, let's say, you've reached your cap of 30,000, can you reapply for this?
No,
Okay.
this is for this year, you can't.
All right. Thanks.
See, we went through this this process for over 2.5 months, trying to understand how it will work, because this particular scheme of OPD insurance is still not under the IRDA. So everybody has got a different rule, everybody's got a different formula. And the ones that we were trying to speak to earlier, they said that as if there's any kind of an invasive test, like if it's an angiography or something, then we will not permit you. If it's an MRI, we will permit you, but if it's an angiography, we will not permit you. While Aditya Birla said that as long as it's a test which is prescribed by the doctor, we will permit you. Now, suppose you went to a hospital, let's say you went to the Apollo hospital. The doctor they prescribed you, and the Apollo hospital itself has the test facilities. They will immediately transfer you for the test to their own facility, and they'll do the test there and then only. So what basically you are doing is you are getting a discount of a 30,000 rupee over a period of a year, a 30,000 rupee payment of your doctor fees, consultation fees, and test fees for yourself and your family is being paid of at a 20% price at 6,000 rupees, because it's 5,000 plus taxes. So it's ultimately going to cost you 5,900, and so it is 6,000 bucks for you. So 6,000 out of pocket is going to cover you for 30,000. But for your parents, it's going to be 10,500 plus taxes to cover you for 30,000, because the liability for a senior citizen for going to the doctor is much higher. So they are finding it to be a higher risk. So they refuse to give it to us at the same rate. So that's why the differential is there, but they're covering it to you up to the age of 70.
I think up to the age of 70 is a great benefit also. So any other questions? Can we take any other questions? I see one on the chat box. Okay, this is more of a reply.
Hi, this is Anup here. Just one quick question. I'm not sure if this was covered. Is vaccination visits also covered in OPD? For the babies, I mean.
No, sir, vaccinations are not covered. Only prescribed diagnostic tests are covered.
Thank you.
Okay, wonderful. So I don't think there are any more questions.
There's a mailer which would have gone out this morning, and that mailer does contain all that thing that Mohit spoke about. That mailer has all that thing in that in detail. So you could have a look at it, and in case of any query, you could reach back to us at the association and we would come back to you with a query, or you could just at the Chungi just put a message in and we could just come back to you with a clarification. And the most important thing is to reach out to your batchmates and to tell them, and this is a very limited time offer. We are going to close this at the end of this month. So it's a very limited time offer because it's a very risky offer. So we, from the insurance side also, we only have 2 weeks for us to sell the product. So end of the month we'll be closing it. We do not have too much time. So we need to rush out and we need to reach out to all our batchmates because it's a nice product to cover the family for all doctors and tests visits.
Hi Vikram, I'm Padmanabh representing IMT Hyderabad campus. So
Yes.
could you please help us getting that mailer, because I think I have not received that mailer.
Okay, if you could just share your email address with Debashish, we will have it sent across to you.
Okay, we'll do that. Thank you.
So Manasvi will send it out to you right away. I think it has gone through the website. So you would have received it if by the name of IMT Alumni Association. If you've not received it, Manasvi will send it across right away.
Sounds good. Thank you. Thank you so much.
Actually, some mailers are still in the process. So maybe by 12 p.m., like 12 noon, you all will get the mailers.
Okay, there are 20,000 mailers going out, so it will take time for the mails to also shoot out.
Okay, okay, got it.
So this is just to do the conclusion part of today's session. This is the first of the 4-part insurance this year, the OPD scheme, where we are covering the doctor visits and the tests. After this, we will be coming in with the basic health insurance plan. And in August, we are going to come back with the renewal of the top-up scheme, which we launched last year. And this year will be the renewal time for the top-up. So those who had done last year top-ups will come into for renewals, and then new people can also add into the top-up. And later in the year, towards the end of the year, we are trying to see if we can get a group life insurance also done for the alumni. So we could do a term insurance also for the members. So these are the insurance policies that we are trying to see that can be done.
Excuse me. Hello. I wanted to ask, like, I live in a small city, Roorkee. So I just downloaded the app and I could not get the list of hospitals. So I'm not sure, like, in a small city like Roorkee, how many hospitals are impaneled and will I benefit with this?
Shivam, can you share me your PIN code where you are searching for the hospitals or the doctors nearby? I'll just speak with the insurer on the same, that if they have any way of getting it covered as well. So just share me your PIN code, because they have given me a list of the PIN codes which are covered. So I'll just check over there.
अच्छा शिवम, what you can also do is that in case you feel कि उसमें से कोई भी list में से कोई तुम्हारा नाम नहीं आ रहा है पिन कोड में, and you have a good hospital, I'm not talking of a private doctor, I'm talking of a reputed hospital there in Roorkee, you feel, which is a multi-speciality hospital, then you can share that hospital's details online or with Mohit, and we can check with Aditya Birla if they can empanel them.
Okay. Thank you.
Okay, na? Are we okay with everybody?
I guess so. I think most of the queries have been answered, and people can reach us out on WhatsApp, website, or directly contact Mr. Vikram Shah or Mohit or Manasvi on this initiative.
So you need to basically reach out to your batchmates. That's most important.
It's a great initiative, Vikramji, and I think the calendar looks quite interesting. The way the insurance products are coming up, this is looking really nice. Thanks for all this.
Welcome, sir.
Yes, I second that. Thank you so much.
I think it's a great initiative. I think kudos to the team that has worked on this, and keep up the good work.
Thank you.
Thank you. Bye.
Have a nice day, and please get your batches in.
Surely we'll do that. Thanks.
Bye.
Thank you.
Yes,
Thank you.
we
We'll
will.
do that.